Good morning, everybody. I'm Ashraf Raycliffe, the National Occupational Health and Safety Training Manager at the National Institute for Occupational Health, the NIOH, and welcome to another training webinar, COVID-19, a COVID-19 training webinar as part of the NIOH's COVID-19 webinar series. Today, we are dealing with what was, I think, originally termed a return to work topic and was broadened to be termed the Occupational Health and Safety Workplace Systems and COVID-19 topic. And we have quite a good team today from the NIH, mainly from the Occupational Medicine section, as well as from the Safety, Health and Environment Department of the NIH, and the SHE department serves the larger mother body, the National Health Laboratory Services. So by way of introduction, the NIOH is a specialized division of the National Health Laboratory Services, and we bring you these webinars under the broader auspices and banner of the NHLS. And the NIOH is a sister institute of the National Institute for Communicable Diseases, the NICD, another division of the NHLS. So we're delighted to bring you this webinar, and we can discuss the key aspects of how the workplace-based systems, the health and safety systems, would need to run, and what are those key elements and priorities, who are the key role players and stakeholders, and what are the priority aspects we've got to deal with in order to ensure that all our workplaces are key places to ensure that the COVID-19 national epidemic and the global pandemic can be dealt with effectively, given the ongoing developments and challenges, as well as the importance of the vaccination program that needs to be undertaken and as well as accelerated within our national context. That in itself is a very important priority. So we then have our team to deal with the question of COVID-19 in the workplace, and I will in a moment introduce you to the content of our program. So just also to indicate, all of our COVID-19 webinars are recorded, and presentations and other additional resources that are made available for you free of charge by the NIH is available on our website. And our website, that is www.nih.ac.za, is free in terms of data cost or charges. It has been zero rated by all of the major mobile service providers, as well as an internet service provider. So if you visit our website, www.nioh.ac.za, it is zero rated and you will not be charged any data when you do that. Also, we have a YouTube channel, a Twitter channel, as well as the important hotline that you would have seen advertised also in our slides just prior to our start. In addition to that, if there are any other sort of questions or general comments or inquiries you might have, we encourage you to email info@nioh.ac.za. That's info@nioh.ac.za. Okay, so just a quick bit of administration, and in terms of our webinar sort of housekeeping rules, because of the large numbers of attendees and participants that we have, we allow for interactive engagement. That is through two mechanisms and functions of Zoom, the Zoom platform. We ask you to please type your specific questions for the presenters and the content of their presentations in the question and answer box. That's the Q&A box. You'll see it at the bottom of your screen. If I'm pointing in the right place, it says Q&A and it's got two speech bubbles at the bottom. The other function is the chat function. And in the chat function, we are going to ask you to type any other general aspects, issues, questions, or comments you may want to make. Please do not type your general questions around, can I get the slides, etc., in the question and answer box. I repeat, the question and answer box is only for your questions for the presenters based on their presentations. That's where our presenters and panelists also from the Occupational Medicine and SHE department would be answering your questions, and you can see the answers there. Okay, so the last one I just need to mention, apart from that, your microphones are deactivated as our attendees. The raised hand function, because of the microphone deactivation, is not applicable to our webinar. If you want to raise any question, which we cannot allow you to share with us live over your microphone, you would have to type your question or comment in the chat box. We are monitoring the chat box and will respond to you with regard to that. A general certificate of attendance is distributed, and for those who are members, and that's obviously members in good standing of professional bodies that have accredited our COVID-19 webinar series, there will be a link and a password sent to you within 24 to 48 hours after the webinar for you to do the online CPD test to get your continuous professional development attendance certificate. Okay, with not further details and further delay, our series of speakers starts off, and apologies, just to mention that Dr. Tanusha Singh, who is the chairperson of the COVID-19 Occupational Health Outbreak Response Team, the COVID-19 OHSS team of the NIH, was going to do the welcome today. Unfortunately, she was called to an urgent engagement for the NIH elsewhere and could not join us this morning. So an apologies from Dr. Tanusha Singh. So our series of presenters, getting back to the program's sequence. Firstly, we have Dr. Nompumelelo Ndaba, who's our acting head of the NIH's Occupational Medicine section. She will be dealing with the COVID-19 update and workplace preparedness. That's followed by Dr. Edward Sipirwa, who's going to also from the Occupational Medicine section, who's going to deal with the necessary occupational health and safety systems in the workplace. This is very important for all of us, from those who are the directors, managers, occupational health and safety officers, the health and safety officers, the COVID-19 compliance officers, all health and safety reps, the shop stewards and labor representatives, and all employees, as well as the other professionals who assist in our workplace in supporting us around the COVID-19 workplace preparedness and prevention. So Dr. Supirwa will then deal with that, the necessary occupational health and safety systems in the workplace. And that's followed by the Dr. Masvita Berry, who's going to deal with the additional workplace systems during the time of COVID-19. You know, what are those specific and particular ones, given the current challenges that we're facing since the beginning of last year. That's followed by Dr. Shlonipile Maso. She will be dealing with the Occupational Surveillance System, the OHSS. All workplaces are required to engage by regulation and law in providing information around COVID-19 cases, etc., in the workplace to the Occupational Surveillance System, and Dr. Maso will deal with that. We then conclude with Michelle Morgan from the NHLS or NIH National SHE Manager, Deputy Manager, and Michelle will be dealing with what every manager should know and do. So a very good sequenced and important topics that we have for today's webinar. And without a further delay, I'm going to ask Dr. Ndaba, Nompumelelo Ndaba, to just join us and share her slides and check her audio, and if she prefers her video. While she's doing that, a quick check on the attendees list. Brenda Mogogo, Katrina Brandt, Zenita Ngubeni, Griselda Knox, please, if you could lower your hands, and then we will proceed with that. So by way of introduction, if I could just quickly get my screen sorted. Dr. Nompumelelo Ndaba is an occupational medicine specialist based here at the NIOH. Dr. Ndaba's current role at the NIOH involves teaching in various programs for occupational health professionals, including postgraduate diploma in occupational health programs on the academic platforms. Dr. Ndaba serves as a member of the reviewing committee of the Medical Bureau for Occupational Diseases, that's the MBOD, particularly also looking at mining aspects, In the COVID-19 era, Dr. Ndaba developed and delivered training materials and presentations on COVID-19 in the workplace for different audiences, as well as coordinating webinar sessions like this particular one. And as I mentioned before, Dr. Ndaba is our acting head of the occupational medicine section. With that brief introduction, I hand over to you, Pume. So if you could just check your microphone, if your audio is okay.
Good morning, Ashraf. Is my audio okay?
Perfect, perfect. If you could just stay close to your microphone on your computer, and I see your slides is maximized. Please proceed. Thank you.
Thank you, Ashraf. Thank you, colleagues. Thanks to our coordinators, our IT colleagues. Good morning, everyone. We thank you for taking time to join us in this webinar. We really feel privileged to be welcome to your different workplaces to share what we seem to be gathering as we go along on this topic. We've been with COVID-19 from last year, March. We've been preparing these webinars, but we still felt the need that we need to provide a brief update of where we are, what are we doing, and just as a sense of minimizing panic in different workplaces. I don't know, my slides are not moving. Okay. So we will start by checking where we are. And if you look at the global statistics in terms of global cases to date, we're just above 168 million, and in South Africa, just above 1.6 million cases to date. And in terms of deaths, we've had plus minus 3.5 million deaths to date globally, and about more than 55,000 deaths in South Africa. So on the left-hand side of the slide, you will see there's a graph. I know it's very fine print, but if you can follow as I take us through the graph, this graph starts from the 5th of March 2020 up to 2 weeks ago, plus minus the 14th of May 2021. You can actually trace or appreciate from the graph that where our first spike was, our first, the high number of cases, actually any time from April last year up to coming down to about August, that was our first, what we refer to as our first wave. Then we saw a little bit of, cases coming down with the interventions that were there. And also in our country, there was various stages of lockdown at that time. And then again, around November, we started seeing spike of cases, for which the highest number was around January, late December, January. And then it started coming down again. And from what we see, if you look from the 29th of April, we seem to be seeing numbers going up. And as we know, it's been declared, or we've been warned that we are officially in the third wave of COVID-19 in South Africa. On the right-hand side, if you can see, there's a breakdown of provinces in terms of how we're doing with numbers to date. Hence, there was a need for us to talk about this and, not just have a third wave and not being sure what are we to do, is everything still fine? But having said that, prevention goes on in terms of workplace measures that can still be enhanced. So if we look at the vaccination programs that in terms of South Africa and globally there have been about 1.7 billion doses given, and then in South Africa about 7,000 doses. Sorry, about 7,000 doses, and then internationally or globally, we've had about 403 million people fully vaccinated, which is not the case in South Africa, or it's much more lesser. But you'll recall that in South Africa, our first vaccination was a once-off dose, which is why we could have that high number of cases vaccinated. In terms of percentage of population fully vaccinated globally, we have about 5.2%, people that have been vaccinated. If you consider that Africa seems to have the lowest number of people vaccinated, so the coverage is low, but then that is actually from the other countries where they've got high coverage. So for our South Africa, only 0.8% of the population has been fully vaccinated. So if you look at the graph on our right-hand side, This is in terms of the vaccination status. We start with the fully vaccinated, like I mentioned, because the dose, the type of the vaccine that we started with was a single dose vaccine. So it was easy to say how many are fully vaccinated. So if you check from from mid-May, we started having at the top cases that show that have had one dose but are not fully vaccinated. This is because in the country there was introduction of the Pfizer vaccine, which is a 2-dose vaccine. So currently we know that the numbers are coming up, but then we still don't have the ideal at least 66% vaccination, which was estimated as the number that was going to give us herd immunity. So we've had a lot of questions in terms of, should we remove these restrictions now in South African workplaces? Should we now ease controls? So some of the questions have been around, can we get our vulnerable workers returning back to work? You know, it seems like everything is fine now. Now the work must continue as before. Should we do away with the mask at this stage? How about social distancing? Can we go back to our normal meetings or our normal pre-COVID statuses? And in terms of the lockdown, is it still necessary that we have lockdown? And how about traveling for work, you know, in terms of being fully free to be able to do that? On the other side, we're looking at the current situation, as I've mentioned. We know we're in the 3rd wave. We've had limit vaccination, which is much, much lower than what would give us herd immunity. And we are officially in the winter season. It's very cold currently. So now if you think about, you know, in terms of balancing, it seems like the seesaw seems to be turning more to, you know, the right, in terms of the current situation is not allowing that we ease the controls in place in the workplace. I'd like to remind colleagues in terms of the main functions of occupational health, which include promoting the improvement of working conditions and other aspects of environmental hygiene. So if you recognize that occupational health is closely linked to public health and health systems development, COVID has highlighted this because we cannot treat the workplace as a separate entity. The workplace and occupational health systems are closely linked. Actually, they are a sub-part of the public health system and the health systems development in the country. So whatever happens in the country directly affects what happens in the workplace, but also the reverse can be true. If occupational health and workplaces are not vigilant enough to also assist in managing the pandemic or any health challenge in the country, then you might find that it will affect our overall public health systems and means that have been introduced. So when we try to address all, you know, determinants of workers' health, previously we were just saying workplaces can just do medical surveillance and just focus to what comes from the workplace. But now if you look at issues like the risk for disease and injury in occupational environment, social and individual factors, which have been very much highlighted during the time of COVID, and also access to health services, which have been also elevated during this time. So we've done these trainings and we've been with COVID, as I said, for more than a year now. But we have a few lessons that we have learned, which we thought it's worth sharing with everyone. So the first lesson that we have learned that COVID has brought to us was around leadership and governance. So we know in the country currently, there's a national coordinating team for COVID-19, not only from the broader public health perspective, but on occupational health specific national coordinating team, which is highlighting team leadership and guidance. For the first time, we have that coordinated response as a country with the representative from both our, you know, occupational health system, the mining and the non-mining sector. At this time, we've appreciated that there's been a huge shift in mindset with regards to practice. So before, occupational health was around only compliance, but now we've moved towards prevention. We've also moved more towards surveillance in workplaces and overall as a country. And we know that there's been an enhanced need for occupational health resources and support. We know workplaces have done a lot in terms of expanding, you know, resources in many ways, human resources, support, IT resources, and so forth. So looking at the focus on occupational services and resources, as I mentioned before, for example, COVID-19, with the new legislation legislation. There have been new regulations and new legislation, but the highlight has been the role of a coordinator in the workplace, named as the COVID-19 compliance officer. We've also had to redefine the scope of occupational health services, and also we've actually learned to look at the vulnerable workers. Previously, we'd look at people with medical conditions from the eye of fitness for duty or not fit, or actually maybe retirement. But now we've learned to appreciate who are our vulnerable workers. How do we better provide for them? We've also learned the role of multidisciplinary approach with a number of key role players that have come together for the first time in an occupational health-based challenge. We've seen COVID-19 showing us that together we can do more. We've also seen the role of the workers and representatives coming to voice the needs of the different workers. And also, when it comes to communication and information sharing, we know that at this time, it has been very crucial to be able to provide timely and succinct communication to ensure that all stakeholders have access to information. And most workplaces have actually redesigned their employee communication strategies. Surveillance as a co-activity of occupational health has actually taken more of a center or a higher platform than before. At this time, we've also experienced elevated, a high profile of mental health issues in the workplace, and even consideration and the need to relook at developing programs and being sensitive to mental health in the workplace. The other lesson we've learned was the issue of working from home. We never thought it was going to be possible. We know it's possible. We are still learning though, even other, we're still gaining other lessons from this. But the issue of working from home, it has become a new normal. We know a lot of workplaces have actually moved to saying they're going to be taking this stance on a much more longer basis. So based on these lessons that we have learned, we are hoping we're not going to reverse, but we know that workplaces still, those that do not have, they still need guidance. So from after me, the speakers are going to talk about the necessary systems that need to be there in the workplace. To some, it will be revision, but it's always a worthwhile revision. And over and above what was supposed to be there, COVID has shown us that we need to have additional workplace systems. And beyond this, as I mentioned, with regards to surveillance, the other topic is going to be on occupational health, the surveillance system that has been developed. And last but not least, one speaker is going to talk to what every employer should know. So this is going to be worthwhile to coordinate and also have your mini audit and check what you have in place and not. Thank you. I'm going to hand over to the next speaker. Thank you, Ashraf.
Thank you very much for that. That was Dr. Nompumelelo Ndaba dealing with COVID-19 update and workplace preparedness. And that sets the scene for us, lays the basis for the sequence of presentations coming. A reminder to all of our attendees, please type your questions for the presenters and the content of their presentations in the question and answer box. Thank you very much. Use the chat box as for general comments or other general admin related matters. Much appreciated. And just a reminder again, the raised hand function is not applicable for this particular webinar. Our next topic is the necessary occupational health and safety system in the workplace. And this is being presented for us by another colleague in the occupational medicine section, Dr. Edward Sipirwa. And while he's sharing his presentation slides, I'm just quickly going to introduce him very briefly, because I think I might have misplaced one of my emails here. So Dr. Edward Sipirwa is a public health medicine registrar, currently working here at the National Institute for Occupational Health. And he is part of the team that has put together today's training webinar on the overall topic, occupational safety, workplace systems, and COVID-19. So thank you very much, Dr. Sipirwa. I see that your slides are being shared. If you could just maximize the slide for us, we can see the smaller slides on the left, and then also just to check your audio. Thank you very much. That is, the slides are maximized. If you could just check your microphone.
Good morning, everyone.
Perfect. Thank you very much. I hand over to you, sir. Please proceed.
Okay, good morning, everyone. I'm Dr. Edward Sipiro. I'm an occupational medicine registrar at the NIOH, and I'll be presenting the necessary occupational health and safety system in workplaces. We'll be focusing on this with regards or in context of the COVID-19. Okay. What we realize right now is that the new thing that's in place, it's the COVID-19 itself, but the systems which are supposed to be in the workplace are not new. There are things which we're already supposed to have. It's just that now COVID-19 has highlighted some of the important things which either were not taken serious or we never really felt and think that those things should be in place. I'll be focusing mainly on 6 systems, but there are other systems depending on the workplace that workplaces can consider to put into place. I'll focus on risk identification and management system, medical surveillance system, incident and accident reporting system, compensation submission systems, together with the key role players within the system, the HR systems, public health systems, and other surveillance systems within the workplace. When COVID-19 struck South Africa or the world itself, the workplaces also needed to be considered so much. So the Department of Employment and Labor issued some direction on occupational health and safety measures in certain workplaces. There was a first direction, then it was later updated, and the second one was on the 28th September 2020. You'd see that from the start of the direction itself, it already tackles one of the major or the best or the very important system within every workplace that should be there, which is risk identification and management. So already you can see from some of the screenshots from the direction itself about risk assessment and plans for protective measures, which should be put into place in workplaces. And it says every employer must make sure that all of these things, the risk assessments are there together with the minimum measures. On top of that, there must be an appointed COVID-19 compliance officer with various duties to make sure that whatever is in the direction itself is implemented. Other implementation of the plans, adherence to OHS measures, information about the updates and address concerns that raises from the workplace with regard to COVID-19, monitor and supervise that all of these measures are in place and implement other risk management systems in the workplace. Risk assessment and mitigation, you need an individual nature of work and workplace risk assessment. It needs to be a stepwise approach while keeping in mind that you need to put necessary control measures to mitigate those risks in the workplace. South Africa is part of the International Labour Organizations, which is a body that helps standardize occupational health and safety matters and other work-related matters for whoever was in the body. You'd see that there needs to be policies within any workplaces. So you need policies which will help guide any incident within the workplaces. You need to organize the workplace according to the policies. There needs to be certain responsible people and who will account. There needs to be competency and training, together with planning and implementation that needs to be there. You need to plan how you're going to execute some of these measures which are going to put into place. Then you'll have to review them. And then after you evaluate the performance, then this will then give you a space to see which loopholes would you see within either the policies or the procedures within the company so that you can improve on those. Individual risk assessment. Individual risk assessment, what you have to do, you need to classify individuals based on the exposure itself. You need to classify how vulnerable they are according to either the matrix which would be shared on various occupational health and safety websites, usually the NIOH website. You need to evaluate the mitigating impact of the risk control strategies You need to score those and then determine the need for accommodation, and then have the various occupational health expertise to help you support with decision making. So as we have mentioned, that all of this is a multidisciplinary approach according to who has certain qualifications, according to what the doctor says about this patient, then you'd come up with how you're going to accommodate that patient or that worker in the workplace. We have a list of vulnerable workers which was issued, or which helps guide the workplace on who is actually at risk. It's just unfortunate that as the workplaces, if they don't have an occupational medical practitioner or a doctor that oversees such issues, you won't get exposures, or this won't be revealed to you unless you have a doctor, so that is a doctor-to-doctor information. As you can see, as I've highlighted here, the issue of immunosuppressive therapy, patients and the use of corticosteroids. Now there's already a question of fungal infections, especially with patients that are exposed to high-dose corticosteroids in treatment of COVID-19. It's the benefit from the vaccination, but what we have been told is that the vulnerability still stands the same, even if the patient is vaccinated. So we continue to adhere to non-pharmacological ways of preventing transmission of COVID-19. So the nature of work is very important also. You need to know that if you look at the direction itself, it actually helps you categorize whom is at higher risk or level of risk in lower risk. So you'd have such matrices to know that within my workplace, I'm dealing with the kind of work I'm dealing with is kind of high exposure risk work or whatsoever. The infrastructure, how do they access the workplaces, the entry and exit? Will it be safe to prevent people from contracting COVID-19? Navigating around the workplaces. Does your workplace allow access of public to get into the spaces? Are there waiting areas? Is it conducive to keep appropriate social distancing? So these need tea rooms, shared spaces. There are some are working open plan offices. There are work transport, which are also the shared equipment or highly used surfaces. Is there risk that one would contract COVID from there? The bathrooms, personal office spaces, public transportation, you look at within the directive itself, you need to cover. You need to cover even the person transporting themselves to work, like issue of giving 2 masks, etc. There are other risk assessment considerations which you also need to consider, like check other work stressors, work conflicts, staff complaints, and cover any other risk which could be in the workplaces, like economic issues, and other. You need to have a comprehensive risk assessment whenever you do a workplace risk assessment. Now we come to a management of your risks. Hierarchy of controls. Many, I'm sure they are very familiar with this diagram here. We already know that when coming to elimination and substitution, it will be a difficult thing to do, or we can say it's impossible, but we can rather eliminate certain cultures or substitute certain cultures in the workplace rather than the risk itself or the hazard itself. Engineering controls. With engineering controls, what you do is you'd isolate employees from work-related hazards. So by so doing, you'll be reducing exposure to hazards without really relying on the behavior of the worker. Issues of ventilation, which has become very important, even though your direction actually helps you guide on some of the ventilation system which needs to be in place in the workplaces. Installing physical barriers, marking your floors, those are very important things within the workplaces. Administrative controls, you need to continue doing these risk assessments, and so this will help you check if you have effective mitigation strategies within the workplace. Early case identification, training your staff, social distancing, sanitizers, and policies and procedures, as we have mentioned. But remember, your policies and procedures, they need to be guided by your legislations or certain standards, which is very important. And then use of PPE, just remember, you need to properly use PPE. Something we are still stressing on right now is using gloves to work, which is actually more dangerous. And the better thing is to continuously sanitize your hands or proper hand washing. So with all of these things that you might have, the policies and how you're going to manage things, you need to continuously update them according to what's transpiring. As we know, that this is a novel virus, it's new to us, they keep on being updates within there. Work on the policies themselves. How are you going to work on screening protocols, issues of investigating your cases? How are you, what's the new isolation procedures, quarantine procedures, an appropriate work list? And you'll also be guided by the COCTA, Disaster Management Act, also at a certain point. Your leave policies, mental health support, you need to notify the OHSS system, which will later be talked about, also the compensations, should it be a compensable disease, a COVID-19 be a compensable disease. You need to have medical surveillance system. Your OHS system your OHS Act tells you about listed works which you should be there, and all the other, according to your risk assessment, what predisposures, what health predisposures could your workers be with? Continuous screening which needed to be into place. It's something which is supposed to be there. Remember, TB also it's an occupational disease. Issues regarding mental health. You need to have screening tools which you might have continuously to screen within the workplaces if these are not a problem. Clinical disease diagnosis, are these occupational or non-occupational? This disease, is it related so much with what the worker do, or is it something that can get outside of workplace? So you need occupational medical practitioners to also help you assist with those things, together with other occupational health, other occupational health practitioners within the workplace. Disease management and reporting. You need to have proper systems within the workplace that will help you manage occupational related diseases or diseases that could potentiate occupational dangers within the workplace. Incident or accident reporting systems, very important. Various acts actually cover this. Case identification and management. Do we need systems into place? We always wanted the systems into place to be there. How are you going to identify cases? Should this case be in a certain manner? How is it going to be managed? The incidents, the accident, and the accidents. Remember, the OHS Act covers all of these things. So you need to be very well conversant with the Act itself. Some of these things is not opinions or specialists or anyone. It's actually an act. It's actually a legislative a legislative requirement that every company needs to do. Your 14 general duties of employee at work, you need to report. Functions of health and safety representative, you need to report. Section 24 actually also gives guidance on which occurrences should be reported. I should have written the section 24, which is actually very important. You need to know which occurrences or which incidents should be reported in the workplace. HR systems, one of the biggest problems, yes, we don't have good occupational health and safety teams within some of the workplaces. You would find that HR is actually also running occupational health and safety, which is becoming a problem in the workplace. Leave management, how do you manage leaves? Which leaves apply to what or on what conditions? You need to have systems within the workplace that actually deals with it. It could be according to the DPSA also, but you need to have those systems, how you're going to manage your leaves properly. Rehabilitation and accommodation. If there's disablement from an injury or a disease at work, how are you going to accommodate? From when the person gets in here, sometimes you need to know, should anything happen, or you need to anticipate, should anything happen, will this person be able to be accommodated in another place? or not. So the HR will also be part of those teams. Compensation system, which is one of the biggest or hottest topics that are happening, revolving in the issue of COVID-19. Compensation submission systems and the key role players. Usually it will depend how beefed up is the occupational health and safety unit within a workplace. The doctor, the OMP will help with the medical reports, the health nurse, exposures or incident reports, and medical questionnaires that might be of need in the context of what has happened within the workplace. HR will help submitting claims and submitting notifications to the compensation commissioner. Supervisors can help with the employer's report and exposures. But if you see in your act, they'll say the employer, but the employer will usually actually delegate some of the workers or managers within the workplace to help with regards to this issue. This danger on duty or occupational disease, there are various claims procedures which needs to be followed. This is an example of one where there's a diagnosis that is made, then there's a medical report. Then if it's an occupational disease, we suspect that an occupational disease will send to the compensation minister. Then the employee will get a relevant assistance at that time, then complete progress reports, and then the decision will be made. It's not very different from injury on duty. Usually the very same step until the commissioner pays medical expense or disablement, should it be judged that this is because of the occupational incident or problem. With regards to claiming for COVID-19 related or work exposures or occupationally acquired COVID-19, there are various forms which would get within the website of Employment and Labor, Department of Employment and Labor, which actually guides you on what documents needs to be submitted on symptomatic, initially asymptomatic, then need to have symptoms, or there's a fatal case. This table easily summarizes some of those things. Fatal cases, you need to come, and you'd see that all the time you need PCR results, which is currently what is recommended, or the only tests which will be applicable when you want to claim for compensation, which is the common issue. Exposure history, which is also one of the important things. First medical report, you need it also together with your progress and your final. So with this, there was first occupational compensation of occupational acquired COVID-19 disease, which was released 23rd March 2020. Then there was a compensation of workplace acquired COVID-19 disease released on 23rd July 2020. According to this, the diagnosis and the work-related of COVID-19, the assessment should be inherent risk posed by various categories of work and occupations, as I've shown in the previous slide regarding the nature of work risk assessment. These are one of the considerations that are there within the directive itself. The exposure to a known source of COVID-19 in the workplace, approved of official trip and travel history to countries or areas of high risk for COVID-19 or one work assignment. There should be a reliable diagnosis of COVID-19 as per WHO guidelines. There's a chronological sequence between workplace exposures and the development of symptoms. Current diagnostic test, the PCR test, which should be a positive PCR test. Notice on compensation. So what makes COVID-19 occupationally acquired? High risk occupation for COVID-19, travel for work purposes to high risk areas, proof of close contact within the work environment. Other considerations: high density, frequent contact, frequent touch, frequent money exchange, poor ventilation, and vulnerable. So your claim to COVID, it will be upon motivation. Why are we saying that this was occupationally acquired? You don't just send within from the workplace, everyone who tests positive for COVID is occupational. There needs to be motivation for why is this an occupationally acquired COVID-19 case. The benefits under the COED, they will be paid on a retrospective basis where cases have been confirmed and accepted. So the health of the person is the one that we would take care of first, and then retrospectively, all the charges incurred either from the workplace side or from the worker's self will then be compensated should it be deemed that this actually was an occupational COVID-19 case. There should be a medical aid to cover the cost of the diagnosis test and all the clinical interventions. And then the cost of pre-diagnostic measures like all the quarantine-approved non-hospital facilities can be reimbursed, provided that the worker had to use any of those. Then a sick leave for work-related disease shall be in accordance with the provision of Section 24 of Basic Conditions of Employment. This is very important. You find that someone has submitted with the COED, and then they are using their normal sick leave. So occupational leave for all occupational related diseases would be appropriate. Also, with some of the cases, it will depend on the leave policies of the company itself, but should be guided by Basic Conditions of Employment Act. Within the workplace, especially workplaces which have health facilities within them, they will do diagnose some of the conditions. Do we have systems in the workplace to report any matter which is public health related? We need to remember that it's a legal obligation for everyone that diagnoses a notifiable medical condition. I think there are various categories. Category 1, it should be reported within 24 hours. Category 2, it should be reported within 7 days. So you need to have those systems into place. From the detection of the disease itself until the reporting. Remember, it's a criminal offense not to report a non-medical, a notifiable medical disease. This is how we find ourselves right now being in this COVID-19 pandemic. Issues regarding reporting, they're querying where the origins, and that's why we usually have to report notifiable medical conditions. Other surveillance systems within the workplace. Occupational health and safety surveillance system, which will later be presented by one of my colleagues. It helps the surveillance for the whole country. It also have a legal obligation that companies with more than 50 should actually register with the OHSS. So surveillance of the work environment, you need to continuously look out for surveillance issues like ergonomics, etc. You need to have those systems in place which will help you overlook everything within the workplace to make sure that you have a good occupational health and safety culture or environment. Thank you.
Thank you very much for that. That was Dr. Edward Sipirwa. And by way of correction from my side, I found that email. Dr. Sipirwa is an occupational medicine registrar. I might have made a mistake earlier in saying public health registrar in the occupational medicine section here at the NIOH. And he started with us, I think, now in 2021. To say thank you to him. He attained his MDCHB from Sefako Makgato Health Science University, a diploma in HIV management in the College of Medicine in South Africa, and a short course certificate in occupational health and safety from the University of Cape Town. Dr. Spiro was responsible doctor for occupational safety services at the Helen France Hospital and all primary healthcare facilities in Blouberg municipality under the Capricorn district in the Limpopo province. And Dr. Sipirwa, as I mentioned, he's a occupational medicine registrar, just again as my correction. And so thank you very much, Dr. Sipirwa, for your presentation. I see that you have some key references there for us on your final slide, and I'm going to encourage all the attendees, when you do receive the presentations within the 24 to 48-hour period after the webinar, that you do consider having a look at some of those resources that Dr. Zipirwa has shared with you. If you could just unshare your slides for the moment, Dr. Zipirwa, and then a quick just admin announcement. We have Mpelinyani, apologies, Mpelinyani Moleme and Motunde Ravengani and Siseko Mugungo, who's raising their hands. Please lower your hands. We can't accommodate you with your raised hand functions. Rosalind Williams as well. So, okay, having said that, please type your questions for the presenters and the content of their presentations in the question and answer box. We have too many participants on board on our webinar to have an open microphone or to accommodate the raised hand function. Also, if you've got any other general comments, admin-related questions, etc., use the chat box for such general comments or questions. And then our presenters who are presenting and panelists will be answering your questions in the question and answer box. They will be checking for the questions there as well. So without further ado, I'm going to move on to Dr. Mazvita Mberi, who's also in the occupational medicine section here at the NIOH, and she's going to deal with the additional workplace systems during the time of COVID-19. And while she prepares her slides, by way of introduction, a very short bio sketch. Dr. Mazvita Mberi is an occupational medicine registrar who's currently working in the National Institute for Occupational Health. Dr. Mberi has worked in the public health and NGO sectors and is passionate about health systems and health service quality of care. She will be talking about the additional workplace considerations, as I mentioned, during the time of COVID-19. So Dr. Mberi, thank you very much. I see that you shared your slide. If you could just check your microphone and audio quality, and then I can hand over to you officially.
Hi, Ashraf. Thank you for introducing me so kindly. And I don't know if you can hear me. Can you hear me?
Perfectly, perfectly. Good quality audio. Thank you very much.
All right, so I'm just trying to see. Good morning, everybody. I'll be sharing about additional workplace considerations during the time of COVID-19. I think a lot of, I'm just going to check how I can write. Just in terms of what a lot of what I'm going to be discussing has been discussed previously, but I'll just try to also just reiterate some few important points. Just as an outline, I'm going to go over regulatory frameworks. I'm going to go over aspects of the Occupational Health and Safety Act and go on to talk about COVID-19 health promotion in the workplace, and then how workplaces can initiate COVID-19 control programs, as well as the prevention strategies that they can use. And then I'm going to end off by just mentioning a few common and statutory law principles. So in terms of regulations, we're still functioning under the COCTA Disaster Management Act. And so it's important that we still continue to adhere and to be aligned with that act. As usual, we do subject ourselves to the Occupational Health and Safety Act as the workplace, and more especially Section 8, which talks about the regulations for hazardous biological agents with reference to the COVID-19. And then we also have regulations from the Department of Employment and Labor, which includes the COVID-19 occupational health and safety measures in workplaces. They have sent out a document, they've gazetted this document, and also gazetted a document about workplace preparedness around COVID-19. And then there's also various other guidelines, the Department of Health guidelines, the NICD guidelines, as well as the environmental health guidelines. And the different departments also have their specific guidelines that have also been gazetted. So in terms of the Occupational Health and Safety Act, I think as an employer, I think you have certain duties that you need that you have to adhere to, and These include being able to develop a workplace preparedness plan. And I mean, in terms of developing these plans, it's really important for workers to work for employees to engage and continually communicate with their workplace employees as with them and the different levels of workers within their institution. And it's important for them to you know, determine what kind of prevention strategies they're going to opt for, as well as how they're going to implement these strategies. And something that most workplaces would forget would be that there's a need for them to also monitor and evaluate whatever they are actually implementing, to ensure that they're actually getting the effect that they need to get out of that strategy that they've opted for. And then workplaces also need to develop guidelines and protocols for their workplaces. And as previously mentioned, it's important that you continuously do hazard identification and risk assessments. I think someone just asked a question just now around whether once people have been vaccinated, is there a need for risk assessments to continue to be undertaken? And you must remember, with vaccinations, they will decrease you know, your risk of getting COVID-19, but they definitely do not eliminate your risk. So it's important that as long as we are still under the COCTA Disaster Management Act, we continue to do, and even outside of COVID-19, it should be standard practice that workplaces do hazard identification and risk assessments within their workplaces on a continuous basis. And then it's also important for the employer to be able to adhere to safe work practice norms. So, I mean, employers really have to, especially with COVID-19, you know, sometimes you find that there's people that will have a whole blame game thing going on. You know, you got sick because of this, or, you know, an employer feels this employee, you know, deliberately got infected, or whatever, you know, issues may come up. But it's really important, if we're going to avert the COVID-19 pandemic, for workplaces to really have, you know, to really have an environment that allows for COVID-19 health promotion. And this can be done by creating an enabling and supportive environment. And I think I've mentioned the blaming thing. Employers should really try and stay away from things like that. And having effective non-repressive COVID-19 policies. And these policies should really be, applied, in a fair way across all, in all different situations. And there's a need for mediation and advocacy for employees. This can be done by the occupational health and safety reps or the committees that may be within the workplace, or even by management. And then it's also important for employees to be supported to develop their personal skills and find ways of navigating how they can minimize their risk of getting COVID-19 in whatever situations, whether in the taxis, whether in their homes, whether in the communities or in the workplace. And it's also important to ensure that employees are actually actively engaged and they participate, in the workplace COVID program. They are part of it, and they choose to adhere and to work with the occupational health and safety departments to ensure that COVID is really averted within the workplace, and obviously in the community, and even nationally. And then it's for some workplaces, there's really a need to reorientate health services. Can I say actually in all workplaces? Because, for example, now we have screening in the front. What do you do when someone has a positive screen? Do they go to a workplace facility, or does that mean you have to establish on-site health services, occupational health services, or do you need to isolate and link that worker to the nearest facility? And that needs, all these measures really have to be in place if you're going to promote an environment that allows for the aversion of the COVID-19 epidemic. So in terms of initiating a COVID-19 control program, there's different things, there's different ways you can approach this, but this is one of the ways that I've seen being that we did, for example, in Ekurhuleni Health District. Firstly, you need to establish a committee or a team with clearly assigned roles and responsibilities of team members. There needs to be a platform for COVID-19 information, training, and education. And these platforms should really be easily accessible to employees and to employers. We need to have a workplace assessments and situational analysis so that you know what measures are in place, where are our strengths and weaknesses, and how can we strengthen our strengths, how can we strengthen our strengths and also, you know, address our weaknesses. And then identification of vulnerable employees has been mentioned before, and also medical surveillance of those vulnerable employees. And then we've discussed before the need for you to determine what COVID-19 control measures you are going to be going with. And then initiate, in terms of, there's a need for, you know, evaluation and surveillance procedures to be in place. So you want to be able to look at exposures, you want to be able to monitor exposures and even monitor, you know, outcomes and even risks and how they change over time, and being able to also identify what the sources of those exposures are. You need to have, we've talked about monitoring of your program, and you need to really ensure that you have smart program indicators. You need to be able to, when you set up a program, you should have objectives that, you know, that you can quantify, and you can say, you know what, we are doing well, we are not doing well, how can we improve, and how can we do things better. And then in terms of record keeping, we need to obviously keep records. I think in the next slide, there's a small picture that shows you, and I mean, records means, you know, how many employees do we have? How many have had COVID? How many, you know, today, how many people tested COVID? How many people had to be sent for testing? How many people had, you know, had symptoms? And, you know, we do these we screen every day on a daily basis in different workplaces, and you find that that information is never really analyzed. So there's a need for that information to be used to actually determine, you know, what is really happening, and to monitor the trend. Is it possible that this week there were many more people that had symptoms than the week before? So this information should really be kept and monitored. And there's also, it's also important for workplaces to have standard operating procedures. And eventually, we've talked about program monitoring, and over time, you need to evaluate the program. So there's different ways of disease prevention. And in terms of COVID-19 disease prevention strategies, we will still use the same framework that we use for, you know, any infectious disease prevention strategies. So we talk about the primordial prevention. This is basically more aimed at, you know, population level prevention, and usually involves something around policy. Primary prevention tends to be a bit more individual prevention and aimed at the individual, and this can include things like vaccination, infection prevention, control, and the wearing of PPE also fall under primary prevention. Secondary prevention includes things like medical surveillance and case and contact management. So once we have someone who has COVID-19, what do we do? Tertiary prevention is about long-term rehabilitation. How do we bring them back into the workplace? What needs to be done to enable them to be functional as an employee again? You know, are they eligible for compensation or not? And I'll just go into a little bit more of that in the next few slides. So in terms of primordial prevention, and I've talked about policies, we need to adhere obviously to the national and provincial policies. And then we also need to have specific work policies and procedures around COVID-19. So things like, you know, there should be specific documents that you know, address the issue of social distancing, mask and PPE wearing, quarantine and isolation, symptom screening, cleaning and disinfection, vulnerable worker, like we've mentioned before. And even we need to look at workplace sick leave policy. You know, what is going to be done around quarantine, isolation, vaccine and adverse events. And I mean, this is really important because, you know, a lot of times workplaces get into trouble because, you know, there is an unequal or uneven way in which workers are inequitable way in which workers are managed, or worker situations are managed. And so when you have a leave policy, you protect yourself, and you also clarify that the workers are able to know exactly what they're in for, and so you actually prevent having ending up in the CCMA or having other negative consequences around sick leave. And then you also need policies around workplace restrictions, who's allowed, who's not allowed. Can someone come in with, can a group of people come in? And if they do come in, what measures are in place? And then also travel and return to work policies. And then now that vaccinations are being rolled out, we'll need to update our workplace policies in terms of vaccination. Okay, so in terms of primary prevention, we talk about infection prevention control. So in terms of preventing COVID-19 infections, the disaster management regulations are quite clear cut. They have very clear, specifications around the things that need to be done, and these include social distancing. And I mean, this is especially as workplaces, you need to be really aware of mobile employees. So you've got an IT guy who moves, from department to department to department, and if that person gets COVID-19, that's that can mean the whole workplace has to be closed. So you need to really make sure that there's strategies to ensure that their risk is minimized, and also the risk of them spreading disease is also minimized. And in workplaces that provide work transport, you really need to have proper strategies around how you prevent COVID-19 transmission within, buses, for example, and what needs to be done, and to also to ensure that this is the policies are there are policies to ensure that people and the workplace adheres to those to physical distancing within transports. And then I mean, another thing that really comes up is meal and work breaks, where you have employees that are eating in a certain room, and maybe that room is big or small, whichever it may be, and you have people in a congregation of people in a room with no face masks on, and who are also talking probably and conversing, and once one person has COVID, it can mean a lot for the workplace. And I mean, different workplaces, use different strategies to mitigate this, things like working from home, shift work, and, having visible signage, having clear signage that says in this room, there's only 2 people allowed to work in here, or in this, if you're standing in a queue, we've seen, for example, in shops, they'll put, signage to say you can stand here, the next person stands here, and this really has to be used. This is useful in different workplace settings. And then in terms of the disaster management regulations, it's also important that is consistent and appropriate use of personal protective equipment, including masks. The workplace also has to ensure that, there's good hand and respiratory hygiene in the workplace. So, I mean, hand washing has been spoken over and over again, and respiratory hygiene is still the same respiratory hygiene we've always had, where, you cough if you're coughing, you're going to cough into your elbow, but hopefully if you're coughing, you have either been really cleared of COVID-19, or you're not if you haven't been, you should really not be at work. As an employee shouldn't be at work if they're coughing, unless they've been cleared. Okay, and then the employer needs to ensure that there's constant availability of PPE. There should be water, soap, hand sanitizer, disposable hand towels, to ensure that infection prevention control is maintained. And then we need to maintain hygienic work areas and minimize cross deployment and movement of workers in the workplace. So if you have different teams working together, you want to try and keep teams together, for example, where as opposed to having teams changing, and then you've got if a certain shift one person gets sick in a certain shift, it may mean that, everyone, because this person has worked in different teams, let's say they're working in 5 different teams at the same time. This may mean that everybody has to, high numbers of people have to go into quarantine or even isolation if they've developed symptoms as well. But these are some of the strategies that some workplaces use to just try and contain COVID-19 within the workplace. So I think at the end of the day, communication is key. Employees need to be capacitated to be able to to practice, to have safe practices within the workplace, and also to minimize any risk behaviors in and out of the workplace. And then another thing that's really important is that there should be visible and accessible COVID-19 health promotion information. I think just and that's another important way of communicating all the COVID-19 information to employees. So COVID-19 vaccination is also one of the primary prevention strategies. It operates under certain legal frameworks. The Constitution states that people have the right to bodily and psychological integrity, and the Occupational Health and Safety Act talks about employer duty to ensure safe working environment, and on the other hand, employee duty to take care of their health and the safety of others that they may have an impact on. And so these will probably be, the things that are going to be used in terms of vaccination going forward, and what their rights are, what the different acts require from them. And in terms of rolling out of the vaccination, there's going to be 3 phases. I'm sure healthcare workers have already been done and are still being done, but phase 2 has already been initiated with essential workers, more than 60-year-olds, more than 18-year-olds with comorbidities, and persons that are in congregate settings. So this may be places like prisons, or it may be in old age homes. They would qualify for phase 2, and then in phase 3, then the vaccinations would be rolled out to persons that are over 18 years old, or to everyone else that's remaining. So when people are vaccinated, when the population is vaccinated, there can be vaccination side effects. These can be local. So you may have pain, swelling, redness at the site of the injection, but there's also a risk of systemic adverse events. This include fever, nausea, tiredness, chills, headache, muscle joints, and pains, and a worker may need to take sick leave because of adverse events. So employers need to be prepared for this and start preparing for more and more of this as vaccinations are rolled out. The employers need to develop and implement policies, procedures, and emergency operations plans that address COVID-19 vaccination. They need to review the HR policies to account for unique sick leave, such as sick leave due to vaccine adverse events. And you need to develop communication plan for sharing credible information. Absenteeism patterns would be for HR prevention plans, outbreak update. That kind of information needs to be available to the relevant people. We also need to provide resources at workplace for staff, clients, and visitors. And it's important for workplaces to actually start commencing workplace preparation for clinic accreditation for possible on-site vaccination. So in terms of secondary prevention, sorry about that. So there's different things, evaluations that need to be done, medical evaluations that need to be done. We need to ensure that systems are in place to identify workers that are at high risk of severe COVID-19, and as mentioned before, they're called vulnerable workers. vulnerable workers can have baseline health assessments, and also monitoring even of possibly, their chronic condition to make sure that, they are controlled and they are in care, and to minimize, the risk of getting severe COVID. And then we talk about COVID-19 screening, which have been mentioned before, for employees and for visitors. And, when someone does have symptoms, rapid separation and testing and case identification of employees. And, what do you do when a visitor has COVID symptoms? And, I think one of the things that have been used in some workplaces has really been the electronic screening, where, people actually fill up their COVID screening questions before they even leave their house, so that the worker knows even before you leave your house that you're not well and you're not coming through. So sick workers never come to the workplace, which really minimizes, the chance of COVID-19 spread within the workplace. And then we've talked as well about, interventions that can be done, that can be put in place to really prevent COVID-19. Once you have, for example, identified a vulnerable worker, they could be placed or deployed in low risk work areas, low COVID-19 risk areas, or they could actually be allowed to work from home if that is possible. So there's, in terms of tertiary management, we need to do a rapid workplace assessment and risk mitigation within the workplace. Once we have a COVID case in the workplace, we need to isolate COVID-19 cases early and rapidly identify and quarantine close contacts, and early access to medical care and mental health support. We also need to reassess workplace COVID-19 controls to see if they're working and what was the gap. Could this have been prevented? Could this case have been prevented? And then we need to also ensure that we notify the case to OHSS, to the Department of Employment and Labor, and also DOH NICD notification for notifiable medical conditions by the attending, which is done by the attending healthcare practitioner. We've talked about company internal reporting and monitoring, and there's a picture here that I was talking about before, and this is literally what you have. And then you have a trend graph, which you are able to monitor over time, how many new cases, active cases, recovered cases, just like what, the Department of Health does. You can actually do that as well within your workplace. And then, the workplace is also obliged to support Department of Health contact tracing activities. And I think in some instances, there's, we experienced situations where a worker is under pressure to be productive, and they simply just don't disclose the fact that, this person actually works with 20 other people. And until you go to the workplace and you find out, actually, and of those 20 people, there's already 5 that had symptoms and need to be tested. And it's really important for workers to really, take cognizance of the fact that we are in a time of disaster, and it's really important for us to ensure that we work with the government and with every country and every person and every workplace has an obligation to try and avert this disaster. I'm sure all of us are looking forward to the day that COVID will be running at a low, or will not be propagating, or maybe one day even eliminated. And then, so it's important as well for workers to ensure that they have cleaning and decontaminate the workplace once someone has been diagnosed with COVID-19 before resuming work within the same area. And this should actually be happening daily, and not only daily, but should be happening many times on a daily basis. Areas should be cleaned continuously to really minimize the COVID-19 risks. Okay, so long COVID is still an early it's in its early stages of really being described, and there's no clear definitions, but the WHO calls it a persistent state of ill health, and they call it post-COVID condition. The British Medical Journal has called it non-recovery for several weeks or months following the start of symptoms that were suggestive of COVID-19, irrespective of whether you were tested or not. So, I mean, different patients present with different symptoms. We find that most COVID cases have mild to moderate illness. 10 to 15% have severe disease, and 5% become critically ill and require, you know, oxygenation and admission and that sort of things. But usually, generally, a COVID case would usually recover within 2 to 6 weeks. But any of these patients, mild, moderate, severe patients, critically ill, can have prolonged symptoms. Evidence shows that these patients are not infectious. I mean, these patients can report such a wide variety of symptoms. They may have normal COVID symptoms, you know, the cough, fever, you know, usually not fever, but cough, you know, muscle pain, you know, and just a normal COVID diarrhea or whatever. But they may also have headaches, chest and muscle pain, forgetfulness and depression, a lot of psychiatric long COVID symptoms. The anosmia may persist, and you know, those are the kind of things that have been reported. And I mean, this all has implications in terms of, you know, the workers' return to work. Can they or can't they return to work if they have persistent anosmia? Workplace accommodation, fitness for work, leave, compensation. Okay, so just to close up, I'm just going to also just go over the, you know, some principles that we need to be aware of in all our dealings as employees and employers. So an employee has a right to seek pay from the employer, and I mean that I think we all know the basic conditions of employment. An employee has a right to receive compensation for workplace acquired COVID-19 disease, but as my colleague has spoken about, it does need to be you know, it's not an automatic. You need to prove that this is really COVID-19 disease that was acquired in the workplace. And then there's UIF sick pay for quarantine for employees, and UIF temporary employer relief scheme for employers. And then it's really important, really, as a workplace to have to update your company leave policies, especially around COVID-19 sick leave. You know, we've been through different stages of the COVID-19 epidemic and pandemic, but you know, we've gone through full lockdown, different alert levels. Vulnerable employees, you know, have to be considered in different ways and different, you know, whether the epidemic is, you know, very, you know, you need to take cognizance of that. Do they need sick pay? Do they, you know, workplace acquired and non-workplace acquired COVID-19 illness, quarantining, whether you was, you know, a private close contact or a workplace close contact. You know, these need to be discussed, you know, within the company policies. You know, someone who has high risk behavior, or does the workplace take that do they take that into consideration regarding, you know, illness, for example? And you need to be able to determine, is there a law around that? You know, are there specifications within the employee's contract? Are there COVID-19 arrangements that apply to that situation? And yeah, so just to really emphasize that workplaces really need to look carefully and just determine, you know, what their policy is, and it should be clear for everyone to know, so as to prevent future negative consequences. And I think, yeah, that's the end of my presentation. Just to acknowledge a few people that have supported us: NIOH Occupational Medicine Unit, Ekurhuleni District Health District Public Health Unit, and those are the references I've used. And I thank you for spending time listening to me. Thank you. Bye. I'm done.
Thank you very much. Yes, thank you very much. That's Dr. Manzwita Mberi dealing with the additional workplaces systems during the time of COVID-19, and I say thank you very much for her contribution. I'm going to immediately hand over to our next presenter, and that's Dr. Hloniphile Maso, commonly and officially known within the NIOH Hloni. So with your permission, I'll call you that online. Whilst Dr. Maso is sharing his presentation, I'm going to just do a very brief introduction. So Dr. Hloniphile Maso graduated as a Bachelor of Medicine and Surgery, MBCHB as it's called, from the University of Limpopo, former Medusa in 2007. He has extensive work experience in both public healthcare system and the mining sector, where he worked as a medical officer and later as an occupational medical practitioner. And it was during his stay in the mining industry that he was also completed a postgraduate diploma in occupational medicine and health at the University of Pretoria. Dr. Maso is currently an occupational medicine registrar here with us at the NIOH, studying at the University of Witwatersrand, Wits University, and is based at the, well, it was mentioned that here with us as an occupational medicine specialist in training. With great pleasure, I hand over to Dr. Maso. Thank you very much for taking the time to sharing your knowledge and experience with us. I hand over to you, sir.
Hi, good day, Asha.
Your microphone is perfect, perfect audio.
Okay.
Please proceed. Thank you.
Good day to everyone. I'm going to be presenting the COVID-19 Occupational Health Surveillance System for South African workplaces, also known as the OHSS. So I thought we could maybe start by explaining what we understand by surveillance. When you think about surveillance, usually this is the picture that would come to most of our minds. So it's a system where you have information being gathered, and usually behind the scenes you have somebody who's collecting this information and deciding what to do with the information. As far as the public health surveillance, WHO defines it as the ongoing systematic collection, analysis and interpretation of health data essential for planning, implementation and evaluation of public health practice, closely integrated with the timely dissemination to those who need to know. So basically, this is a continuous collection of information in a systematic way. When coming to the OHSS as a way of introduction, so it's also the ongoing COVID-19 data collection system that collects information from workplaces for analysis, interpretation, which is essential for planning, implementation, and evaluation of occupational health and safety interventions in response to the COVID-19 pandemic. And this system was started on the 1st of October last year. And the initiative was started by the National Department of Health in partnership with the National Institute for Occupational Health, who are actually the people who are running the system on a daily basis through their epidemiology section at NIOH. And the rest of the other partners are listed below there, who were able to help in the formation of the system, helping either in technical support, in health systems, and in an IT system support, etc. And how did this system come about? So with the country back at work, after the hard lockdown, there was an increased need for a systematic collection of COVID-19 data, especially in workplaces, in order for timeously identify and appropriately intervene in workplaces with high COVID-19 infections. So there was a consolidated COVID-19 directive that was issued on the 28th of September last year. And according to that directive, employers who have more than 50 employees in their companies needed to collect COVID-19 related data. So the kind of data that they were looking at is with regards to symptomatic employees. So that data needs to be submitted on the system weekly. And then there's also data with regards to vulnerability status of employees. This is a once-off submission, but it could be submitted also if there has been any updates on the employee's vulnerability status. And then you need to also collect data with regards to positive case that are identified in workplaces. And the last point there, the data that you need to also submit is with regards to return to work. So basically out of all the positive cases that you had identified, just to say how many have come back to work or what was the outcome, because some of them you might find that they have unfortunately succumbed to the disease. With regards to the aims or objectives of the system, so the system was developed as a framework for COVID-19 surveillance model for monitoring workers in various economic sectors, both in the public and private sector. And it was developed for early identification of sectors and occupational groups at high risk of infection, so as to inform appropriate interventions. Also to evaluate the impact of COVID-19 interventions in the workplace. So you just want to see also as you are applying these interventions as to whether or not they are working. And also to determine the human resource and economic impact of COVID-19 on the various sectors. And to provide regular updates on the trajectory of the pandemic in various economic sectors nationally. And lastly, to identify key scientific questions requiring further investigation. So what happens to the data that is being collected on the system? So the main important issue there was an issue of confidentiality, because obviously people would be concerned with their information as to what happens to the information once submitted into the system. So the data is then stored in the OHSS data lake, which is here at NIOH. And that data lake is anonymized, and the identifying information is removed after a period of 6 weeks. And all the OHSS data collected by NIOH is securely stored and processed in the NIOH data center. And all systems that are used for data collection, storage, and processing are assessed on a regular basis for any security threats. And this data is used to monitor trends in the disease and identify workplaces that are high risk and design effective intervention strategies. So the 31st of March this year marked a milestone, a 6-month milestone for the system. So at that point, there had been 3,111 businesses that were registered on the system, which represented 0.1% of all businesses that are formally registered in the country. This talks to a number of just over 1.8 million employees that are registered on the system, representing 13% of all formally employed employees in the country. And with regards to the provinces that are registered on the system, you will see there on the graph above that Gauteng accounts for most businesses that are registered on the system, followed by Western Cape and KwaZulu-Natal, which actually makes sense because these are the provinces that mostly have industrial companies, or these are the economic hubs of the country, so to speak. And the majorities of businesses that were registered on the system at that point were mainly from retail in the sectors of food and beverage. And then, as you could see from my previous slides, the numbers there are very low. So the proportion of registered businesses submitting data is still not optimal. So in terms of data regarding symptoms screening, There were approximately 201 businesses that had submitted data with regards to symptomatic employees on the system. And you'll see there on the graph on your right that symptoms that were most common were that of cough and sore throat, and followed by the rest. You'll see that most interestingly there, the issue of fever. It was about 3% of the symptoms that were reported. And then with regards to cases that are positive, these are the people that were identified as Covet cases from their workplaces. So there were 3,704 positive cases that were reported or registered on the system. And the majority of them were still from the 3 provinces that we've identified, that is Gauteng, Western Cape, and followed by KZN. And sectors reporting the largest number of cases, they included banking and insurance, followed by health and social sector. And the majority of workers who were reported to be positive were mainly clerical support workers. So this is people that you could identify as the front desk employees or frontline employees in the businesses. And 33% of positive cases were actually identified as employees that had contacts at workplace. And 89% of all the positive cases were reported to have been symptomatic at the time of diagnosis. And then of all the people who were positive, 70.6% of them had returned to work by that point. And then 1.5% of them had unfortunately succumbed to the disease. And then 7.5% of the employees had been hospitalized. And on your right there is a graph representing the epidemiological months as far as COVID-19 in South Africa. You will see there that around the time of December going into January this year, it's the time where there seemed to be most cases that were reported of COVID-19 at workplaces, which kind of coincided with the national second wave of COVID-19. With regards to concerns and recommendations in relation to the system, so of concern is the issue of registration, as we've seen that less than 1% of all businesses are registered on the system, which represents only 13% of the workers that are formally employed. And this therefore presents a problem as far as representation of the disease burden experienced by the workers in the country. And then the recommendations that we have there is mainly that of awareness, that we should have more awareness to businesses that they need to register on the system. This we are doing currently through social media and through webinars like today's, and also through our hotlines that we have here at NIOH. And then also with issues of enforcement by the regulator, who is the Department of Labor. And of important, it's a point that I've noted there at the bottom, that there's a new directive with regards to the COVID-19 temporary employer relief scheme, which is popularly known as the TERS scheme. So as far as that is concerned, new development is that as of the 8th of April this year, the directive says that in order to prove that an employer is unable to make alternative arrangements for vulnerable employees to work from home or take alternative measures, and to prove that an employee is in quarantine or isolation and is entitled to the benefits, these are the benefits of TERS from UIF, that the employer must submit the required data to the National Institute for Occupational Health. So this is to the OHSS system. in the manner set out in the National Department of Health guideline. So basically, this is a way of encouraging employers also to register their businesses first in the OHSS system, so that they are able to submit all the required information into the system. So the last slide that I have there is just an informative slide to say if there's any queries with regards to the system where you can send your emails. There's also 2 numbers there that represent our hotline numbers for OHSS. And there's also a link for registration. And with that, I would like to thank you. Thank you, Ashraf.
Thank you very much, Shloni. You have assisted us, or assisted me with my being slightly over our time for the program. So that's Dr. Shloni Pile-Marcel, who is here with our occupational medicine section of the NIOH as an occupational medicine registrar linked to the Wits University, and he dealt with the Occupational Health Surveillance System. For all of you, and there's almost, it's over 600 or close to 650 of you in this webinar, all your workplaces must actively be contributing data to the Occupational Surveillance System as explained by Dr. Marcel, especially if you have over 50 workers in your employment. Okay, I immediately move on to Michelle Morgan, the National Deputy Manager of our Safety, Health and Environment section, and who serves over, I think, 7,000 employees of the National Health Laboratory Services. And Michelle is going to deal with what every manager should know and do. I immediately hand over to her, and by way of introduction, a very quick brief bio sketch while Michelle is preparing her slides. Michelle Morgan is currently employed, as I mentioned, the Deputy Manager of the National SHE Department of the NHLS. She manages and supervises the NHLS SHE offices in all the provinces. That is all the, I think, the 6 or 7 provincial or regional offices. In this role, Michelle is responsible for the NHLS SHE policy development, teaching and training, monitoring and compliance, risk management, audits and inspections, etc. Michelle is a qualified biomedical technologist in the field of biology. She also has a degree in environmental health, qualified with SHENPAC and multitude of other safety courses and training. Michelle has 16 years of pathology laboratory experience and 6 years of SHE management experience, and she's a SANAS trained internal auditor and a trained facilitator. Michelle Fine is registered with our professional council as a member of the committees as SABS and SABA. Michelle is an International Federation of Biosafety Association certified in biorisk management. I immediately hand over to Michelle. Michelle, thank you very much for taking time from your busy schedule and sharing your presentation with our team. I hand over to you immediately. Please proceed. Your slides are maximized. Just want to check your audio. Hi, Michelle. I'm not sure if your microphone is muted.
Sorry, Ashraf. Good morning, colleagues. Thank you, Ashraf. Can you hear me?
Yes, perfectly. If you could just move slightly closer to your microphone, that would be great. Please proceed. Thanks.
Okay, thank you. Good afternoon, colleagues, and thank you for taking the time to attend my presentation. As you can see, the topic is on what every manager should know and do. So basically what I would be outlining is the legal requirements in terms of the Occupational Health and Safety Act and what is required by an employer or a manager. So going to the Act, it consists of 50 sections and came into effect in January 1994. This is just a screenshot of what the Osha Act looks like. The aim of the Act is to provide for the health and safety of persons at work, the health and safety of persons in connection with the use of plant and machinery, the protection of persons other than persons at work, and to establish an advisory council. The Act applies to all workplaces except for mines, mining areas, load line ships, floating cranes, and people working in these areas or vessels. If you are familiar with the Act, you would know that the terms reasonably practicable are mentioned over and over in the Act. So what this basically means is that you must do what you are reasonably able to do to ensure the health and safety of workers. So it is reasonably practicable with regard to the severity and scope of the hazard, the state of knowledge available, availability of suitable means, and the cost of removing or mitigating hazards. So as I mentioned, there's 50 sections, but I've just selected the most pertinent ones that I will go through briefly. So section 17 deals with the health and safety policy. So this is a written policy by the employer. It includes the description of the organization and the ways in which the objectives will be carried out. That is the objectives of the SHE policy. It is signed by the CEO and it is prominently displayed in all work spaces, and it must be regularly reviewed. Section 8 deals with general duties of employers to their employees. So an employer must provide and maintain, as far as reasonably practicable, a working environment that is safe and without risk to the health of his employees. So the Act runs through all of these duties of the employer step by step, from A right up to J. So if you look at the various from A to J, you will notice that in each sentence I've highlighted words. And these words are safe, risks, health, reasonably practicable, hazard, safety, health, risks, right? So in terms, I'm not going to go through each duty. You can access the Act online, and basically it is how the employer would provide a work environment that is safe and healthy for his employee. The steps that he will take, and if you look at this slide, everything that was highlighted in the previous 4 slides boils down to risk assessment. So the fundamental baseline of any health and safety system is performance of a risk assessment. I know that previous speakers did touch on this. So the risk assessment is defined as the process of assessing risks associated with hazards so that appropriate control measures can be put into place to mitigate or eliminate the risk to protect the health and safety of workers. With respect to COVID, a COVID risk assessment needed to have been done in terms of the COVID directive that was published by the Department of Labor. So although a risk assessment is in place in a workplace, a COVID risk assessment would have needed to be put in place at the beginning of the pandemic. And so employers would need to be involved in this and look at risks that COVID may pose in the workplace, and subsequently the control measures that they would put into place to reduce these risks. As I mentioned, every workplace must have a risk assessment, and it must be approved by a qualified team. It must be recorded, documented, kept as a controlled document. It must be communicated to every staff member so that staff are aware of risks and control measures. Because if they are aware of this, then they have the ability to protect themselves. This is just a hierarchy of controls that are put in place, starting from elimination, if possible, right down to PPE. The next section is section 14, right? So section 14 deals with the general duties of employees at work. So here it is what employees need to do in order to take care of themselves, so that, and also to comply with the Act. So just as employers have responsibilities, the employee too must comply with their roles and responsibilities given to them. So if you look at the duties, it is to take care of themselves, the health and safety, to cooperate with the employer, to carry out any order, to obey safety rules, to report unsafe or unhealthy situations, and if they've been involved in an incident, it must be reported. And this must be in line with the safety injury on duty reporting procedure of that workplace. So there may be a specific procedure in place, and that needs to be followed. Moving on to section 16, it deals with the CEO, and the CEO is charged with certain responsibilities. The CEO has the option to assign these duties to subordinates, and many companies have a structure where the CEO assigns these duties to senior executives, executive managers, directors, etc. Whilst the important thing to remember is that whilst the CEO can delegate duties, the CEO will remain ultimately responsible and be held accountable should something happen in the workplace. Section 17 deals with the health and safety reps. So here it specifies how many reps you must have, when you must appoint, how you must appoint, who can be reps. So I'm not also going to go into very much of a detail, but it's required by law, and also the SHE policies of the organization will dictate how many reps they should be, because although the Act specifies one for every, if there's more than 20 employees, they must have a rep. Some organizations, for example, the NHLS, we request that every single workplace, irrespective of the number of staff there, must have an appointed and trained rep. So moving on to how many reps there should be. So the Act specifies for shops and offices, 1 for 100, and all other workplaces, 1 for 50. Activities must be conducted during working hours, and managers must give their health and safety reps time to conduct their work that they're required to do, the duties. And in other words, this shouldn't be done after hours. It should be done during normal working hours. The functions, well, there's a host of functions that the health and safety rep is responsible for. And in terms of COVID, if these structures are in place as they should have been when the Act was put into place in 1993, then this wouldn't be actually a problem in terms of the requirements by the directive submitted by DOL. So all of these things would be taking place anyway, and then COVID would be just incorporated into the system. So they have to review the effectiveness of health and safety measures. They do something called safety inspections, that the time period in which they are done, that's determined by the employer and also should be in the employer's policies and protocols. At the NHLS, we have decided that this is done once every 3 months or every quarter. So these reps need to examine the cause of incidents. In other words, investigate what was the root cause of the incident. They can participate in consultations with inspectors when inspectors come to do inspections at facilities. And they, most importantly, attend meetings of the Health and Safety Committee that they belong to. And in this role, they report on issues in their particular workplaces, and each workplace having a representative then sits together in a health and safety committee that meets also once every 3 months, and they thrash out problems in the entire organization or the complex or section of the workplace. Moving on to section 19, it's health and safety committees. These must be established when there are 2 or more health and safety reps designated for a workplace. The committee must hold meetings, as I mentioned, once every 3 months. Who are members? The safety reps. It's important that there must be somebody nominated by the employer to sit on the committee, and it is advisable that this person be a senior manager who is entitled to take important management decisions. And then there must be a representative from management, there must be a representative from trade union, and also advisory members. And these are people like your safety, health and environmental officer, your occupational health nurse manager, your waste manager, your waste officers, your engineers, people who have the knowledge that they can add to the forum. The functions, okay, so they make recommendations to the employer on matters affecting the health and safety of workers, and discuss incidents. They also discuss risk assessments, and each recommendation, which is part of the minutes, is kept on record, and this is a requirement of the OHS Act. In terms of COVID issues would be in turn addressed in this forum and hopefully attended to. Report section 24 deals with the report to the inspector regarding certain incidents. So it's section 24 incidents are incidents where a person dies, becomes unconscious, suffers the loss of a limb or part of a limb, suffers a permanent physical defect, where a major incident occurs in the workplace, such as a dangerous substance is spilled, there's an explosion, there's an uncontrolled release of a substance. All of these incidents are referred to as section 24 incidents, and they need to be reported directly to the inspector within 7 days. So part of the OHS Act are numerous regulations, and I am also in this presentation just going to touch through a few of the most pertinent ones, that being the general safety regulations. So this one deals with personal safety equipment and facilities, the requirements as per the legal framework, and also it directs and guides managers what needs to be in place. It deals with stuff like intoxication, admittance, unauthorized prohibition, first aid, emergency equipment, and procedures. Then you get the general admin regulations. This also deals with issues like a copy of the Act. It needs to be available. Negotiations before designating health and safety reps. These are negotiations that must be done with representatives from the trade union. Then it deals with reporting of incidents and diseases. And as I said, managers need to have safety protocols that direct staff on how incidents must be reported, and then if there is a compensation claim, how these must be reported to the compensation commissioner. It also deals with recording and investigation of incidents. That is, remember I said having the protocol and making sure that every incident is investigated, that every investigation is reported and recorded, and that corrective and preventive measures are put into place. This is just a screenshot of the Covet Act. Another regulation that's very important also in times of COVID is facilities regulation. That is, what do you need to have in your workplace to ensure that it is safe and healthy for your staff? So things like sanitation are dealt with, facilities for safekeeping, changing rooms, dining rooms, prohibition signs, drinking water, seats, and condition of rooms and facilities. So it gives you direct requirements as per the Act, and it gives you instructions of what you as the manager needs to put in place. Then we have the regulations for hazardous biological agents. So if you're thinking about an HBA, COVID-19 is an HBA. So it's microorganisms, including those that have been genetically modified, pathogens, cells, cultures, etc. So it's your viruses, your bacteria, your fungi, your parasites, and all those agents that are dealt with in healthcare industries. So healthcare industries are your hospitals, your clinics, your laboratories, your forensic labs, etc. So these people are at risk of contracting HBAs, and then this regulation is aimed to provide them with the guidelines that they need to put in place to ensure a safe and healthy workplace. So aspects that are dealt with in the HBA regulations are things like information and training, duties of persons who might be exposed. So you remember I said as much as an employer has responsibilities, an employee too must comply with their part of the deal. So they must wear their PPE, report, etc. It also deals with risk assessments, when they have to be done and how often they need to be reviewed, which is once every 2 years. Monitoring exposure at the workplace, medical surveillance, records, controlling exposure, PPE and facilities that are required for workplaces that are dealing with hazardous biological agents, such as COVID-19, labeling, packaging, transport, and storage, and then disposal of HBA. Moving on to the hazardous chemical substances regulation. This regulation deals with HCS, which are described as toxic, harmful, corrosive, irritant, or asphyxiant substances, or mixture of such substances, for which there is an OEL, or sometimes there is no OEL, but there is hazard to health. So in terms of the regulation, it deals with stuff like information and training, duties of a person who might be exposed, assessment of potential exposure, air monitoring, medical surveillance, records, control of exposure to HCS, personal protective equipment and facilities required to ensure that people handling and working with chemicals are protected, labeling, packaging, transport, and storage of chemicals, and lastly, but not least, disposal of chemicals. So in terms of COVID, all of the aspects of the OSHA Act and the duties of the employer and the manager relates to what would need to be done, including times of COVID. So if systems are in place, it would not be such a challenge for workplaces to comply. This is just an example of some of the brochures and pamphlets NHLS SHE department put into place to raise awareness amongst the community, amongst staff members and the public. So these are precautions that need to be taken for COVID. This is a hand washing procedure, how important it is, although it's only 20 seconds of your life, but can cost you your life. And then hand sanitizing. This is in the absence of clean water and soap, and what would you do when you need to properly hand sanitize? We also developed a strategy for social distancing in terms of COVID-19 and how workplaces must develop a social distancing local strategy for their workplaces. This is a generic strategy, but as the document describes, you as the manager would need to put this in place locally at your workstation. It gives you a background about what social distancing is, why we need to do it, how can we do it, and it's quite a lengthy document that we can share with other organizations as well. Then the SHE department also, sorry, I keep referring to the SHE department, but if you look at your workplaces, the management would need to then develop a risk assessment guideline, because the important aspect in the COVID directive or the direction is that a COVID risk assessment must be done. So although people know how to do a risk assessment, we still develop a guideline so that it's specific to COVID-19, so that it outlines the background about the disease, the ways in which it's spread, and the measures that can be taken in terms of your workplace. So it's important that each workplace does their own, although this is a generic document. I may have one kitchen, you may have two kitchens. I may not have Perspex screens, you may have it. So, you know, it depends on your situation and how you orientate it to make sure that it is safe for your staff. So this is the example of the guidelines that was developed. And then as I keep referring to the direction, I know this is the old one, it has been updated since. And the direction also outlines the measures that must be taken, and it would be your administrative measures, your social distancing measures, your health and safety measures. So it is symptom screening. You need to have a process in place. You need to ensure that you supply and provide sanitizers, disinfectants, ensure that workspaces are cleaned regularly, provide your employees with cloth masks, and take measures in respect of which workplaces have access to the public, and also minimize the number of staff in a workplace, minimize entry of visitors into a complex, increase ventilation, ensure that your meetings take place in well-ventilated areas, use the online platform, Zoom, Teams, there's Google, there's Echo, there's lots of platforms that can be used. And also, last but not least, PPE. It's very critical, especially with staff that are working with the hazardous biological agent, example, Covet. They would need to have a proper PPE to ensure that they can carry out their work and ensure that they remain safe. This is just the SA coronavirus website and how the employer can access it, and the types of documents that are available on the link. And lastly, I'd like to acknowledge the colleagues in the Health and Safety SHE department of the NHLS for their assistance and input into my presentation. I hope that you have learned a lot. And if you do have any questions, you can forward them. Thank you.
Thank you very much for that, Michelle. If you could just have a quick look also at the question answer box to see if there's anything there that might be relevant, Michelle, for you to deal with. I'm going to ask our IT colleague to just ensure that the question answer box is open for a few minutes longer for you to have a look there, as well as our other presenters and panelists. And so with that, I'm going to say thank you very much to all of our presenters, in particular the occupational medicine section and the SHE, the Safety, Health and Environment section of the NIOH, for their planning, preparation and contributions to today's webinar and dealing with all the questions in the question and answer box. I just note that we have more than 75 questions already answered, as well as approximately 2 or 3 that might still need the attention of our colleagues. I'm just going to ask people not to thank us in the question and answer box. Please do that in the chat box. So with this conclusion, I would like to say thank you very much to Dr. Nompumelelo Ndaba, Dr. Edward Sipirwa, Dr. Mazvita Berry, and Dr. Hloniphile Maso and Michelle Morgan, and not to forget Dr. Graham Chin, Dr. Buiswe Nkosi, Dr. Busisiwe Nyantumbu Mkize, Dr. Odette Volmink, and I hope I've not missed out on any of the other panelists who supported us in this webinar in the background, answering the questions you've posed in the question and answer box. And a quick reminder for those who require a general attendance certificate, it will be circulated within 24 to 48 hours after the webinar for those professionals who belong to the professional bodies and is in good standing. You will be receiving a link and a password within 24 to 48 hours to the online CPD test that you would have to undertake in order to secure the CPD attendance register. We will also be sending out all the links to the presentations, video recordings, and any other resources our presenters may want to share with you. And that will be circulated as well as an email after the webinar. And finally, we send you a link to a REDCap survey. We'd like to know from you what you think about our webinars, to rate our webinars, as well as to add in the last question any new topics that you want our webinars to address. So that REDCap link will also be circulated to you within about 24 to 48 hours. So thank you very much, everybody, for joining us. And again, a hearty thank you to our team here at the NIOH. And let's not forget the colleagues in the IT department, particularly Tabani Zwane, and obviously our colleague Glenn Wongani, who's been on duty for this webinar live to support things running smoothly. With that, I'll conclude this particular webinar. I say thank you to all, and we'll see you in our next webinar. The next topic that we'll be dealing with, oops, I can't give you a specific topic there, but we will definitely be circulating the webinar topics to you. You are on our mailing list. Thank you very much. See you in our next webinar. Goodbye.